Hello, everyone, and welcome to this week's It's Worth a Shot. We are going to be going over hospital respiratory data reporting. Mary, next slide. As a disclaimer, because we do have a third party, this presentation may contain information and or content supplied by third parties. Information does not constitute endorsement or recommendation by Mount Pacific. Next slide, Mary. Couple updates. As you guys might know, October is Health Literacy Month. CMS Office of Minority Health is celebrating by sharing resources to help everyone informed on decisions about their health. And October 26th, later this week, is National Prescription Drug Take Back Day. So use the QR code and find out more information on that. It's a good time to help get rid of unneeded or extra prescriptions and to remind people why you don't flush them. Next slide. Also coming up is daylight savings time is ending. For participating states, I want to say Hawaii is one of our ones that does not. So keep an eye out for the new times. I think Hawaii also will be at 11 a.m. it says. So next slide. We get the topics for these webinars from you all. So if there's any topics or ideas that you want us to cover, please add that into the chat or reach out to your account manager. We don't want to cover anything that's not important to you. So the more feedback, the better our topics get. Next slide. As we are getting into flu season, we're doing the snapshots. Looks like everybody is doing what they should between vaccinations and hand hygiene and whatnot. The trend is not happening very quickly. Everybody's still in that green area, so great job, everyone. Next slide. Same with COVID. Trends are still going down or staying pretty similar, which I think we're kind of seeing that we see a spike late summer and then again once we get into the full swing of holidays. So keep up the good work on hand hygiene, vaccinations, keeping people home when they're sick and whatnot. So I know it's kind of been one of those things, but the fact that we're not seeing anything climb shows that you guys are doing fantastic. Next slide. Now I would like to introduce Tori Dahl. She is with the Montana Department of Public Health and Human Services. Tori, it's all yours now.
Thank you, Jamie. So today I'm going to be talking about everyone's favorite topic, the NHSN reporting, so National Healthcare Safety Network reporting, and the upcoming changes to the hospital respiratory data reporting. Next slide, please. So first, I just wanted to point out that you are not alone in your respiratory illness reporting requirements to NHSN. So here is just a little cheat sheet chart of all of the respiratory illness reporting requirements from CMS by type of reporting requirement and facility. So as you can see here today, we're going to be focusing just on that respiratory illness hospitalization section under the patient safety component. And this will be a requirement for all of our hospitals, including our rehab facilities and psych facilities, as well as our Indian Health Services hospitals. If you do have any questions about CMS reporting requirements for your specific facility, we just ask that you please contact the CMS QualityNet Help Desk for questions regarding that. Next slide. So as many of you know, beginning November 1st, all hospitals, including our freestanding inpatient psych hospitals, freestanding inpatient rehab facilities, inpatient psych units, and inpatient rehab units, and Indian Health Services hospitals will be required to submit respiratory illness, which includes COVID-19, influenza, respiratory syncytial virus, RSV hospitalization data into NHSN to fulfill the upcoming CMS requirement. Now, just a side note on those inpatient psych units and inpatient rehab units, these units should have their own unique CMS CCN number that is different than the main facility CCN. So if you are or do have one of those units and it's still the same CCN as a hospital, you don't have to worry about reporting specifically for that unit. It would just be if they had a different CCN number. So the data will be entered into a new hospital respiratory data reporting module, which became available on October 9th. And the old hospital COVID-19 reporting module, which I'm sure you're all used to reporting to, was deactivated on October 9th. Next slide, please. So here is just a quick reporting time frame. This is hot off the press. So we did have some changes that occurred earlier this week for some facilities. So facilities that fall under the requirement to report either weekly or daily would be our short-term acute care hospitals, long-term care hospitals, critical access hospitals, oncology hospitals, children's hospitals, and the Indian Health Services hospitals. Now, this is new, so those hospitals required to report annually would be our freestanding inpatient rehab facilities, freestanding inpatient psych facilities, and then any of those rehab units or psych units that are with their own CCN number. Next slide. So I just wanted to go a little bit more into detail for those individuals who have to
Tori,
report.
sorry to interrupt you. Can you speak up a little bit? You got kind of quiet there. You might need to lean a little closer to the microphone.
Yes, I can do that. Is that better?
Yes, that is. Thank you so much.
Okay, perfect. So for our annual reporters, they only need to report 1 a week in January of 2025. So that here are your 4 options for reporting for those weeks. You just need to pick one. That doesn't mean that you necessarily have to report for just that 1 week, but you do need to pick one of those. You can voluntarily report throughout the year if you feel like you want to do that. And you can either use the daily or weekly pathway reporting. And you still should report all the same information that's required of the weekly and daily reporters. And next slide, please. So I just wanted to go into what is the same between the COVID-19 hospitalization reporting versus this new respiratory illness hospitalization reporting. So first, the reporting can still be done through EM Resource or Javari. I know that some other states also use that. Just to keep in mind that you can't backdate when you're using this method of reporting. So if you are going to miss, say, a weekend or a holiday of reporting, just make sure that you are putting that into NHSN directly. The other option is just to report directly into NHSN, either through the manual entry or the bulk upload of a CSV file. Reporting.
We have a couple questions in chat. So one is, so is weekly or daily just a choice as long as it's done at least weekly?
Yes, so we'll get into that in just a little bit. I'll go a little bit more into detail about what those differences are.
Perfect. And then we have another question that says, who is only an annual reporter?
Yes, so our annual reporters will be our inpatient psychiatric facilities or inpatient rehab facilities or any of those units within a facility. So all of our other hospitals are still falling under that weekly or monthly, weekly or daily reporter.
Thank you.
Perfect. And then as far as the reporting time frame, reporting is still due by Tuesday of the following week, and the compliance period is still that 4-week period for reporting. Now, most of the required data elements are the same for this reporting as were required previously. So you're still going to have to report your inpatient beds for all types, adult and pediatric, inpatient bed occupancy for all adult and pediatric, intensive care unit beds, all adult and pediatric, ICU bed occupancy, all adult and pediatric, and then your COVID-19 influenza RSV hospitalizations, adult and pediatric, COVID-19 influenza RSV and ICU hospitalizations, adult and pediatric, and then COVID-19 influenza RSV new hospital admissions by age group. Then the next slide, please. So what's different? For this reporting, COVID-19 influenza and RSV data are now all required. Previously, they were not all required and some were optional, but for this, they are all required now. Your personal protective equipment or PPE and supply data are optional now. And there are now the two reporting cadences, the weekly and daily reporting. So I just included a little screenshot. So if you do click in that hospital respiratory data reporting module, you'll see at the top either daily hospital reporting data or weekly hospital data. And next slide, please. So just to go a little bit more in depth into what that will look like. So hospitals have the choice to choose either to report daily or to report weekly. So here is sort of the breakdown of how you would do it if you were reporting daily. So for daily reporting, you would need to report your new admissions every day of the week. And then every Wednesday, you would report your hospitalizations, bed capacity, and occupancy data. At the end of the week, NHSN will total up your new admissions for you to give them an aggregate count of that data. And then as you can see, your supplies are optional for reporting for that. And then next slide. For your weekly reporting, you would only be required to report basically every twice a week. So you would report every Wednesday that hospitalization, bed capacity, or occupancy data. And then at the end of the week, you would calculate up your total weekly new admissions and report that all into NHSN. So really the main difference is just that weekly total. Either you just want to enter the daily numbers in and have NHSN calculate that for you, or you can calculate it on your own and just enter all that data into NHSN at one time. And then next slide. So I just wanted to go into some frequently asked questions that we've heard a lot. So the first is, do I need to include patients who tested positive at home or a physician's office and are being admitted inpatient? So the answer to this one is yes. A positive result in the prior 14 days, whether completed as an inpatient or outpatient, can be used as a laboratory confirmation for reporting that admission. Question number 2 was, should I include swing bed patients in the inpatient bed count? We get this question a lot. So yes, inpatient bed counts are not location specific unless your facility has that inpatient rehab or psych unit that is CMS certified. All inpatient beds, which include the ICU beds, regardless of location, should be counted, either in that adult or pediatric count. Do nursery and neonatal intensive care unit beds get added to the pediatric bed count? The answer is yes to that one as well. And then our last question is, if my facility is part of the annual reporters, do I need to start reporting on November 1st? So the answer to this one is no. Annual reporters should begin reporting in January, January of 2025, choosing at least one of the weeks for required reporting. That doesn't mean that you can't start reporting on November 1st, but your requirement would be that 1 week in January. And then the next slide. Just some friendly reminders. Data entered into NHSN for the hospital respiratory data are part of a CMS requirement. So be sure to also follow your state's requirements in regards to COVID-19, influenza, and RSV as reportable conditions. So for example, in Montana, COVID-19 and influenza are both on a reportable conditions list. So we would still need that to be reported to either your local or state health departments. NHSN data may not fulfill the requirements as it's collected in aggregate, and so no patient level information is collected. And I believe that is all of the information. I know that was fast and furious. So if anyone has any questions, any concerns, hesitations, has anyone explored the module yet, or any lessons learned from those individuals?
Yeah, feel free to come off mute if you guys have any questions or type them into chat.
Yes, that's correct. So I see one that says NICU and nursery are both in the pediatric count. Is that correct? And that is yes. Both of those should be included bed count in your pediatric count. The next question is, if a patient develops COVID-19 after admission during hospitalization, do we still count them? And the answer is yes, you wouldn't count them in your new admissions, but they would be counted in that hospitalization count. So if we are reporting weekly, what is the first date we report? So this is really up to you. I would wait until that week is over. So the week runs from Sunday through Saturday. So you can report the following Sunday, or when you get in on Monday, it's due by Tuesday of that following week.
And Tori, can I add to, this is Jamie with Mount Pacific again.
Yeah.
Please make sure as you guys are signing up or having staff turnover or whatnot with NHSN, that your person who's responsible for it has a backup, and that person has a backup. We see a lot of, especially nursing homes, get cited because the individual that is responsible for entering in the NHSN reporting is sick, or something happens that they're not able to be in the facility, and that facility gets cited because they didn't report on time. So please make sure you have a backup in place.
We always say best rule of thumb, always have 2 people in NHSN, just in case one is out.
Mm-hmm.
And then I see one from Katie. So Katie, just a follow-up question. Is that a long-term care facility or a long-term acute care hospital? Both. So long-term care nursing home and an acute care hospital, 2 separate, but under the same. Okay, perfect. Yeah, so you would follow the hospitalization reporting for the acute care side, and then for the long-term care side, there is additional reporting for that side as well, which I didn't include in this presentation. But there is a respiratory pathogens and vaccination module for a long-term care, so that should be filled out as well.
Do we have any other questions for Tori? Looks like it's slowed down in the chat and we don't have anybody coming off mute to ask. Okay, let's go to the next slide, Mary. Tori, do you want to go over your resources?
Sure. So these are just a couple of resources that were used in the development of this presentation, or I thought may be useful for you guys. So the first is a link to the CMS reporting requirements. I always like to click on this. They have it in a nice little chart broken out by facility type and what's required to be reported and the reporting frequency. So I always like to point facilities in that direction. Currently, it doesn't have the hospital respiratory data reporting on there, but just know that is a requirement. The second link is just to the page for the hospital respiratory data reporting. The third link will bring you to the protocol for the hospital respiratory data reporting. So this can answer some of the more in-depth questions you may have as you're filling that out, as far as like what definitions are and things like that. The fourth bullet would be for that weekly healthcare personnel COVID-19 reporting that you should be doing for vaccination data, just in case you have forgotten about that. So you should still be reporting that 1 week out of every month. And then the last link is for the healthcare personnel flu vaccination information, which is due yearly in March. And that is all I have.
It is, sorry, Katie. So Katie said, Anna said, this is Anna, isn't this meeting for LTC facilities each week? We do have some hospitals that come on and join. We are primarily geared towards the nursing homes, but we do have other people on the call as well. So we thought this was timely to go over with them because they do start the reporting on November 1st. And I understand that the LTCs have been doing it and are going to maintain doing it, but just wanted to put this timely out there with the deadline, or the, I don't know if you call it deadline, start date coming up. Looks like we have another one on the FAQ you included with the meeting messages. This link does not work. All right, so I will go ahead and check those. Some of these came out prior to, they came out during the presentation, and so then they were added to the FAQ. So I will go back and look at that question and get that corrected. Thanks for the update, David. I'll go ahead and get that checked. Callie, what was your comment on for the, we have infection preventionists that cover reporting for both as well? Oh, about the content for reporting hospitals versus nursing homes. Correct, yeah. And it is confusing. Like I was just at the infection prevention meeting in Anchorage a little bit ago, and it was touched on a little bit, but the fact that it's something that long-term care facilities have been doing, and now it's something new for the hospitals, and there's not quite exactly the same, but we still give the same information, like make sure you have at least 2 people that are signed up to report in case somebody's out on vacation or you have staff turnover. Make sure you kind of set a day that you guys want it to report, so that way it's kind of a set protocol for you guys to report. And I believe, and this is just from the last meeting that I was on at the Alaska APIC annual meeting, they said try not to leave it until Sunday because you never know what might come up or what happened. And sometimes reporting on the weekends are a little difficult, but and if anyone that actually does the reporting already for the nursing homes wants to come on and potentially give advice to some of the hospital facilities that are going to have to start doing this reporting, that would be beneficial as well. If anybody thinks they've got a good pattern or process down. Looks like we got somebody that reports every Friday.
So, hey, this is Dana from Central Peninsula Hospital. I just had a question on the reporting. So is my understanding that we need to report for the week of like a Saturday through Sunday, and then it's due, is it correct that it's due the following Tuesday? So we really have that Monday, Tuesday to be able to report all of it for the week prior?
That is correct, Dana. So Mary, if you want to go back to one of the calendar slides, either 15 or 16. You can see here. So the submission deadline for week 1, so days 1 through 7, so that Sunday through Saturday would be due on that next Tuesday, the following Tuesday.
So on day 10.
Yeah.
Correct. Okay.
That's correct. And then I know this sometimes happens, but if you're out or something, you don't have to necessarily worry if you miss that deadline. The real major deadline is that deadline on the 28th, day 28. So that would be your 4-week compliance period. So that's when they're going to pull the report, the big report that goes to CMS and lets them know like, hey, this hospital missed a deadline. So I say, it's good to keep on top keep on top and always report by that Tuesday. But do know that there is that second catch where if you do potentially miss reporting by that week and can't get it in, you do have that, it's the 4-week compliance period is when it's due.
Okay. Thank you for that. I had not heard of that before, so thank you.
Are these on Eastern Standard Time Zone? Or is it the time zone that your computer signed in on?
I have to check. CDC did and NHSN did put a timeline on their website, so I have to check to see what the date was, but I'll send that
Perfect,
to
no
you.
problem. So if you guys join us next week, I'll have a questions and answer slide, and we'll make sure to get that answered first thing in the beginning of this webinar, so you guys can see that. I do know that some of CDC's report or CMS's reporting is based on where your computer's logged in, not necessarily Eastern time. So that way we're not penalized for being further away, but that's not true for everything.
I put a link in the chat to the guidance on that.
Perfect. Yep, there's a link, and then it looks like Anna said it's 11:59 Pacific Standard Time is what they said. Right, do we get everybody's questions answered? Thanks, Anna. So she was on the CDC webinar on the 16th that stated that, at 11:59 Pacific Standard Time. Yep, Guam is 14 hours ahead, so they're basically in the future. Yep. Okay, so we can just go ahead and go to the end. Next week, I'll be doing the presentation, and I don't know if you guys have noticed, but Mountain Pacific has migrated to a new website look, and so we're still in the process of moving all of our resources over, but it does have a bit of a new look. And we did run into a bit of a glitch. I think everything from July on is slowly getting added, but it might not quite be there. We do realize that, and we're working on it. But next week, I'll go ahead and go over what it looks like, where our resources are stored now, how to navigate to them. And also, you know, if you guys see anything that's different or odd, definitely let us know so we can pass it on to our communications team to have it fixed. And then we'll also go over the stats for It's Worth a Shot so far. So this was supposed to start as like a 19-week program, and I believe we're on 138. Don't quote me. Yeah, next week will be 140 that we've been together. So I'll give you some updates about everything that we've had through there. And then again, the evaluations in the chat there, if you guys can go ahead and fill it out. I'll have some information about the evaluations next week as well for you guys to see how many people have filled it out and what our average scores are and whatnot. So if you guys go ahead and fill that out, we really do appreciate it. So thank you for spending another Wednesday with us. We really appreciate your patronage of this webinar. And I'm sorry if we indirectly confuse some people between hospitals and nursing homes and long-term care. We should have been a bit more clear about the audience specifically for this webinar, but I hope everything's fine, and that if you guys do have questions, do not hesitate to reach out to any of us. We'll make sure we get that cleared up for you. So hope to see you next week. Thank you.